Hello, my name is Catherine Pirkle. I am an associate professor at the University of Hawaii at Manoa. What I'm going to present to you today is entitled Adolescent Fertility and Health Consequences Across the Life Course. And this presentation is in collaboration with Dr. Sayonara Kamara from the Federal University of Rio Grande do Norte. So I'm going to start by saying that work we have done has provided substantial evidence that adolescent fertility is associated with numerous adverse health outcomes such as disability, cardiovascular disease, and obesity. So I will first show you some examples from our work that demonstrates associations between adolescent fertility and health outcomes in older adults. So here is work that we did quite a while ago, and we used a study called the International Mobility and Aging Study, or IMIAS, to explore whether or not in a cohort of older adults, so individuals 65 to 74 years of age, if amongst women in this cohort, if having given birth as an adolescent was related to physical function. So in this case, we measured physical function with the short physical performance battery. This is a tool that looks at the time to conduct several tests. So the time to conduct a chair stand test, a time to do a gait speed test, and the time one can balance in different positions. Lower scores on the SPPB are associated with poor physical function and with things like hospitalization and premature mortality. This tool has been used in hundreds of studies and is very well validated. So based on our work, what we saw in these older adults were that women who reported that their first childbirth was at 18 years or less had lower average SPPB scores than those women who reported that their first birth was at 19 years of age or more. So when you look at this figure, the dark blue columns are women who reported giving birth as adolescents. The light blue columns are women who reported giving birth as adults. We also use the same study to look at whether or not there was an association between adolescent fertility and chronic conditions. So in the IMIAS study, we looked at a number of self-reported chronic conditions. These included everything from hypertension to arthritis and osteoporosis. What we saw, again, in this group of older women, those who reported that they gave birth at 18 years or less were significantly more likely to have high blood pressure, diabetes, chronic lung disease, and stroke. So we did another study, again using the same data set of older adults. And we looked at whether or not adolescent fertility was associated with frailty. So I will start by saying that frailty is a geriatric syndrome. Frailty is associated with decreased physical and mental reserves, and often measured in the same way that we did. So we used a measure developed by Freed and al., and it looks at low grip strength, low energy, slowed walking speed, low physical activity, and unintentional weight loss. So people who reported these in different forms were considered frail. So the scale actually uses multiple ones of these to say if they have so many of these, they're considered pre-frail or frail. So in our case, we looked at adolescent fertility and frailty. And frailty is very important because it's associated with falls, mobility decline, hospitalization, disability, and death. And once again, we saw that women who were adolescents when they first gave birth were more likely to be frail as older adults. In a third study, once again using the IMIAS data, we looked at if there was an association between adolescent fertility and a risk score for cardiovascular disease. So we used the very highly validated Framingham risk score. So people who have higher Framingham risk scores are at increased risk of cardiovascular disease within 10 years of taking that test. So what we saw with using that outcome, the Framingham risk score, is that women who reported having given birth at less than 20 years of age, so 19 years or younger, had higher cardiovascular risk than all other age groups examined. So we compared them to women who were 20 to 24 years old when they first gave birth, women who were 25 to 29 years old when they first gave birth, women who were 30 years and older when they first gave birth, and women who never gave birth. And in all cases, those who were adolescents when they first gave birth had higher average Framingham risk scores. In other words, a higher risk of cardiovascular disease. Finally, in another study that we did that is related to this, we actually looked at adults in the United States. So we used something called the Health and Retirement Study. This is a prospective longitudinal study of older adults. So adults were first recruited into the study at 50 years of age, and they've been followed for many waves since. So when we were looking at data from the Health and Retirement Study, all of these individuals were older adults. And what we were interested in was whether or not the number of children somebody had over their lifetime was associated with heart disease. So we weren't able to look at adolescent fertility in this data set because they didn't collect that data. But they did collect information on how many children somebody had over their lifetime. And what we did that was unique is that we looked at this in both men and women. So how many children did women report having, and how many children did men report having parented? So what we saw was that those individuals who said that they had 5 or more children over their lifetime were at increased risk of heart disease compared to those who only reported having 1 or 2 children. So amongst women, they were at higher risk. So we saw consistently that women who had 5 or more children were at higher risk of heart disease than those who had 1 or 2 children. And this was even after we included quite a number of other factors that are associated with heart disease. The relationship was very stable. When it came to men, we saw that when we compared to 1 or 2 children, that there was initially an association, but as we added other variables, that association diminished slightly and became no longer statistically significant. However, when we changed the comparison group and we looked at men who had 5 or more children and compared them to men who never had any children or never thought they had any children, we ended up with a significant relationship. What's important about these results, again, keeping in mind that this is not adolescent fertility, but the number of children that somebody had over their lifetime, is it suggests that physiological characteristics of women alone can't explain the relationship. This is because if we're seeing the relationship in men and women, it means that we can't say, oh, it's just hormonal changes related to reproductive health that explains the relationship in women, because it's happening in men as well. And this strongly suggests that the reason we're seeing associations between reproductive health and later life health outcomes may be due in part to social experiences. So now I'm going to present some results that we have in middle-aged individuals and those who are even younger. So we've had the opportunity to analyze different data sets than the ones just presented. We've looked at individuals who were of reproductive age and of women of middle ages. So these first results that I'm presenting to you is from very recent work. So we've looked at data on women from 14 low and middle income countries. So these are places like Cambodia, Pakistan, Peru, and Albania, for example. And these were representative surveys. So these were large surveys of women in each country that were weighted statistically to be representative of all women in those countries. These studies include women of what we call reproductive age, so women aged 15 to 45 years of age. So what we did is we examined age at first childbirth with relationship to mobility disability. And we saw that at all ages, women who had given birth as adolescents, defined as 10 to 19 years of age at first childbirth, had a higher prevalence of mobility disability. And this result was highly consistent and stable, meaning that we were seeing it across a wide diversity of contexts. We also had other work that we did previously using a middle-aged cohort of women in Northeast Brazil. And when we looked at adolescent fertility, especially amongst women who were middle-aged and reported that they'd had many children over their lifetime, they had worse physical function. So we looked at grip strength and the time to complete a chair stand test in this study. And we saw that women who had given birth at less than 18 years of age and who also had 3 or more children were substantially more likely to have lower grip strength and take longer to complete the chair stand test. Both of these measures of physical function are related to poorer later life health, such as hospitalization and premature mortality. What's important to note about this study was that nearly 90% of adolescent mothers also had 3 or more children. This is in comparison to a little less than 50% of adult mothers who had 3 or more children. So this goes back to what I mentioned earlier, is that people who have an elevated number of children are more likely to have been adolescent parents. What we did that was important about this study is we tried to understand why adolescent fertility might be related to poorer health outcomes at later ages. So again, we were looking at middle-aged women who reported on the ages at which they first gave birth. So we did mediation analyses. So we tried to understand what might be on the pathway relating an event like adolescent fertility to later life poor health outcomes. And we explored income, education, income and BMI. I don't remember if we did education or not. Please forgive my omission here. What was important is that we saw that those with higher BMI, so among those adolescents who had 3 or more children, they also tended to have higher BMIs. So a higher BMI due to having had a child at an earlier age might partially explain poorer health outcomes as women age. So I mentioned earlier that income and education might also be mediating factors. This makes sense. Women who give birth as adolescents are at high risk of dropping out of school, and lower educational attainment is associated with lower income over a lifetime. So in the 2 studies where we had information on income and education according to whether or not somebody was an adolescent when she gave first birth or an adult, we see results that we would expect. So in the study by Camara et al. That looked at middle-aged women, those who reported being adolescents, 81% of them also had low incomes, and 40% of them had low educations. This was much higher than what we saw amongst the women who reported giving birth as adults. Similarly, in the study of older adults, in the IMIAS study, we saw that those who were adolescents when they first gave birth tended to have lower incomes in comparison to those who gave birth at older ages, and similarly tended to have lower educations than those who gave birth as adults. So yes, adolescent mothers are more likely to have lower education and lower incomes. However, when we statistically controlled for these factors in our models, they did not change the measures of association between adolescent fertility and the health outcomes we were looking at. So this suggests that these variables may not be mediators. They may not explain the relationship between adolescent fertility and these health outcomes. Of course, we only have 2 studies where we were able to look at this. Much more research is needed to see if this is indeed true. So now, as I finish up this presentation, I'm going to give some examples of future research that might be worthwhile doing. So it is very possible that violence is a contributor to the disability that we are observing amongst adolescent mothers. So we know that violence is associated with frailty in older adults. We've seen one study in that MES cohort that I mentioned earlier that demonstrated that childhood physical abuse and adult intimate partner psychological violence, both of these factors are statistically associated with frailty in older adulthood, and that the association was partially associated with depression and chronic conditions, keeping in mind that we have seen an association, for example, between adolescent fertility and chronic conditions. We have never tested whether or not adolescent fertility is associated with violence and therefore associated with poor health outcomes in any of our work. And this is an area that should be assessed. Unhealthy coping behaviors like smoking might also explain why adolescent fertility is associated with poor health later on. In the first study that I showed you, where we looked at adolescent fertility and older adulthood health outcomes, we saw a relatively strong and statistically significant association between adolescent childbirth and chronic lung disease. Of course, the most important risk factor for chronic lung disease is smoking. We similarly saw an association between adolescent childbirth and hypertension. And once again, smoking is an important risk factor for hypertension. Finally, in the study that looked at the Framingham risk score, we saw that adolescent mothers were more likely to have higher Framingham risk scores. And one of the factors that's used in the calculation of the Framingham risk score is smoking. So those people who report smoking will have higher Framingham risk scores. There needs to be research to assess whether or not adolescent mothers are more likely to smoke than adult mothers, and whether or not smoking mediates the relationship or is on that pathway between adolescent childbirth and poor health outcomes later in life. Finally, we have completely unexplored whether or not social support is a factor that's important in this relationship. Better social support might lead to better health outcomes amongst adolescent parents, whereas poor social support might lead to the opposite. So the association between multiple children and heart disease in both men and women suggests a social pathway that might link reproductive factors to poor later life health. And one of those factors might be social support. We would also suspect this is the case for adolescent childbirth and later life health outcomes. It is probable that insufficient social support to help with child rearing negatively affects health. And it may be that adolescent parents are less likely to have that social support. For example, in many contexts, adolescent childbirth is socially stigmatized, and that might negatively affect one's ability to have sufficient social support. So those are 3 areas that deserve further research, and I'm sure you can imagine many others that might explain the relationships that we are seeing between adolescent fertility and poor health across the life course. So to conclude, there is ample evidence that adolescent childbirth contributes to poor health across the life course, but there needs to be more work to understand why that relationship exists. So I want to thank you for your participation and your watching of this presentation. I hope you have a good rest of your day, and thank you again.